everyone. We have created this video in an effort to provide the same message to be given to staff with commonly asked questions related to COVID, PPE, and commonly asked questions. So with us, we have our experts from infection control and our clinical nurse leader. So Baby John, our clinical nurse leader, and Wendy and Janice, our infection control nurses. So Janice, if you'll start us off with just a basic overview of PPE requirements for COVID-related patients.
Sure. So out in the hall, you can wear a surgical mask. But when you're going to go into the room of the COVID positive patient or the PUI, then you want to put on your booties. Then you're going to put on a gown, and that can be a disposable gown or a reusable washable gown. Then you want to perform hand hygiene and put your gloves on. And then to go into the room, you're going to wear an N95. And then you also have to have either a full face shield or goggles.
So there's been some discussion about possibly using washable yellow gowns. Is there any special precautions that I need to do with the washable yellow gowns?
The only issue with the washable gowns is some people have voiced that they're afraid of contamination when they put it on. So what we recommend is that when you tie it, because you can't break away like you can with the disposable, when you tie it in a bow tie like you would if you're tying shoes, so that you can easily untie it, it won't knot. And then just keep in mind when you're taking it off that the front is contaminated, so you want to try not to contaminate yourself. But one of the things that you can do is you can have like a buddy system. So you can come to the door and call someone to help you and turn around and let them untie the gown for you.
What is the best way to store PPE? Reused PPE, like my face shield or goggles. What's the best way to store that?
Your N95 mask should be in the open paper bag. Your face shield should be cleaned with the alcohol, and it should be in a separate paper bag, or you can hang it on the hooks on the computers. But they should not be stored together in the same paper bag.
Is it necessary to wear double gowns?
You don't have to have double gowns. If you're in the same room, in a shared room with two COVID positive patients, you can have a same gown, but you have to change the gloves between the patients. Perform hand hygiene and change the gloves, but you don't have to double gown.
Can a COVID patient be placed in a regular room with no negative airflow?
Yes. Negative airflow or negative pressure rooms are not required for positive COVID or even PUIs. Initially, when we were first learning about coronavirus, that was the guidance, but now that we've learned it's really droplet how it's spread, we can use a regular room.
Do we change PPE between the same patients in a shared COVID room?
In a shared COVID room, the only thing that you would change is your gloves and perform hand hygiene.
What do I need to wear if I transport a PUI or COVID patient?
So when you're transporting a COVID patient or a PUI, you want to be sure that you wear an N95 and gloves. The patient should be wearing a surgical mask. Now, if you, during transport, feel like you're going to have to work with the patient, they're removing their mask or whatever, then you might want to also wear gloves. And one recommendation is before you leave that room, you might want to also wipe down the bed rails or cover them with a clean sheet just to make sure that you don't contaminate anything along the way.
Can we call an escort when we transport a patient, and
Yes.
what would their role be?
Good point. Yes, you could call escort, and then they would serve as a marshal, and they could push elevator buttons, open the door for you, that sort of thing.
Okay, how about the process for discharge? Would that be any different?
The process for discharge is not any different than any other patient. When a patient is discharged, we do terminal cleaning. But with the COVID patients, we are trying to do the True D, so that's going to add 45-minute wait on that. If there had been an aerosol generating procedure performed in the room right before they're discharged, then we do have clear times for the rooms, and that's based on the number of air exchanges in the room.
how long can I use the face shield for? Do I throw it away at the end of my shift?
No, you don't want to throw the face shield away at the end of your shift. As long as the face shield is in good condition, you can reuse it. You just want to make sure that you disinfect it after you use it.
There's been some discussions as to whether or not a surge is still going to happen or not. So if we're in the presence of a surge and we have a lot of patients down in the ED, what is the process for cleaning prior to admitting a new patient? How long do we have to wait until the room is clean?
It's the same as if you were having a patient discharged on the unit. Once they're discharged, you use the regular terminal cleaning. If you use the True D, which we're trying to use, it's 45 minutes.
What PPE do I wear if I go from a COVID room to another COVID patient room?
What you would do is you can still wear your N95 and your face shield or goggles from room to room, but before you leave one room, you're going to take off your booties, you're going to take off your gown, you're going to take off your gloves, and of course you're going to perform hand hygiene. Then when you go to the next room, you're going to don, your booties, your gown, and your gloves.
So if I were going from a PUI patient room to a COVID positive patient room, would that process be the same?
It would be the same.
And would it be the same if I was going from a COVID positive patient room to a PUI room?
Yes.
Okay.
Same.
Can I wear the shoe covers out in the hallway?
No, you don't have to wear the shoe covers in the hallway. You must, however, wear the shoe covers in the patient's room and remove it before you leave the room.
Should trash and dirty linen be treated any differently? And so if I'm the nurse and I'm in the room and I want to take out the linen or the trash, do I need to double bag it? Do I need to wear special PPE in order to do that?
No, the trash and the linen are treated the same as any other patient's trash or linen. In fact, the trash is not considered biohazard just because it's in a COVID positive patient's room. Now, I do know that some units are choosing to, when they have trash to take out, the person in the room will actually get the trash together, and then there'll be a clean person outside the room with an open bag, and they'll put the bag in there, in which case they would be double bagging. And that's fine to do, it's just not a requirement.
Do they have to have the full PPE if the clean person outside receiving the trash?
No. I mean, of course they should have on gloves, but yeah, they don't have to.
And it does not have to be red bagged. It is not biohazard trash.
Does the elevator need to be cleaned after a COVID patient is transferred through there?
No, you don't have to clean the elevator right after transferring a patient through there. However, if there was any bodily smell in the room, in the elevator, you have to clean it. But before transporting, you have to clean the side rails, as Wendy stated earlier, and put some clean linen on it to prevent them touching on the walls of the elevator.
If I were caring for a COVID positive patient and they pass away, is there any special requirements for post-mortem care for that patient?
Post-mortem care is just like with any other patient, non-COVID. What you want to do, though, is you want to make sure that the person in the room is going to be helping place the patient in the body bag. They would have on their PPE, and there is a recommendation on the thickness of the body bags, but that's not an issue here. Ours are what they should be. But disinfect the outside of the body bag after the patient is in the body bag, and that's all you have to do differently. But there is an SOP on this, and every unit has a resource binder, and that's where you will find this SOP.
So if I wanted to find more specific information about how to transfer a COVID positive patient or more details on postmortem care, that I can find that in that resource binder at the charge nurse desk on the units?
So in your resource binder, you can find the transportation policy, the postmortem policy, and the CPR code response changes in the COVID for the COVID patients, as well as the BCMA changes. You can find them all in your resource binder, which is in the nurse station.
Okay. I think this covers all the commonly asked questions. Thank you for your time, and thank you to everyone, and have a great day.